We'll start now with the item 5, sub-item A. It's my pleasant duty to call upon the rapporteur to read out the resolution we have adopted in our private meeting with regard to the nomination of the regional director. This is simply for the purposes of record. Dr. Rano Rahimova, you have the floor. Thank you.
Thank you, Chair. The draft resolution of the nomination reads as follows. The Regional Committee, considering Article 52 of the Constitution and in accordance with the Rule 47 and its Rule of Procedures, first nominate Dr. Hans-Henrik Kluge as Regional Director for Europe, and second, request the Director General to propose to the Executive Board of the appointment of Dr. Hans-Henrik Kluge from 4th of February 2025.
Thank you, Dr. Rahimova. I would like now to invite Dr. Kluge to address the committee with a short statement. Dr. Kluge, please, you have the floor. Thank you.
Dear Mr. President, dear ministers, ladies and gentlemen, I want to say a very warm thank you to all the member states of this region for placing such a trust and confidence in me again. On the way in, there was someone asking me, but Dr. Kluge, are you not sad that it's 52 and not 53? I say, thanks God it's not 53, or the whole European press would have said, again, fake elections. I want to thank, in particular, my home country, Belgium, and my dear friend, Deputy Prime Minister Frank van den Broeke. It are also very important political times in my native country, and for you to spend the time here, Mr. van den Broeke, means a lot. And also thank you to your whole team, Professor Dirk Ramakers and all the colleagues. I am so humbled to have the privilege to continue serving in this role. The last 5 years as a regional director have been deeply rewarding, definitely challenging, but truly the most enriching professional experience of my life thus far. I could not dream of a most inspiring job. And I would like to thank a number of people here. I would like to thank in particularly both my parents, the 2 reasons I was inspired to choose this path all those years ago. They say the apple never falls far from the tree. My father, a chief traumatologist, taught me Victoria Amat Kuram. Victory loves the preparation, which you may have seen of the Hans talk yesterday. My mother, a chief nurse, instilled a strong sense of service and compassion and giving back to the community. They say that the best advocate for nurses and midwives is the son of a nurse, so now you know the secret. I also would like to thank my elderly sister Adelheid, who is a teacher. Being a medical doctor, I'm very chauvinist that this is the most important job, but I always make an exception for education. we can lift so many girls out of poverty and prevent them actually on violence if they know their rights. Education is so important. So I also want to thank her for that one. Definitely a big thank to my big brother, Dr. Tedros, who has been very patient with me. Now I understand if we have a bit of a difference in opinion, I have to take a step back because usually Dr. Tedros thinks 2 or 3 steps ahead of me. And only later I understand. So thank you so much, Dr. Tedros, for all your camaraderie and guidance. You can count on me. I would like to thank, like I did yesterday, all the staff really, in particularly the Executive Council, the directors, and of the Regional Director Office, because they have to work very, very hard, but I'm very, very blessed with such a team. We work a lot on emotional intelligence, on walking the talk, getting away from silos and territorial approaches, and they're really setting an example for all the staff, but also in technical excellence. Technical excellence will continue to be the North Star of this office. And that's what you asked me yesterday, to really provide excellent evidence. I would like to thank the man next to me here. He's my real compagnon de route, RD Emeritus Marc Danzon. Merci beaucoup, Marc, cher Marc. Many people ask me, how do both of you come along? Mark has, so many qualifications. One of them, he never sleeps, which is actually very useful because I need my 8 hours sleep. So if I sleep, I know there's an RD Emeritus watching Europe and Central Asia. Thank you for this, Mark, for never sleeping. And another of the many qualifications, Mark is never irritated when I do not follow his advice, which is very important because many advisors are a little bit irritated if I don't follow their advice. Sometimes I feel Marc is almost relieved when I don't follow his advice. Marc, thank you so much. Vous êtes un très grand monsieur. Très grand monsieur. And finally, I would like to thank the 3 most important people. My wife, Katrina, and our 2 daughters. Actually, Katrina is not here. She is very disciplined. She has classes. I told Katja, you cannot do this. You know the people, they will immediately start bad-mouthing. She says, don't worry, I will show up at your reception and at once I will kill all the rumors. Dear friends, the next 5 years will be far from easy. As we all know, this region, the whole world, is enduring a period of perma-crisis, which by its very dictionary definition means there is no turning back in the foreseeable future. So all the more, we need to walk side by side, hand in hand, to ride this wave. I outlined yesterday what we hope to achieve with the European Programme of Work, EPW2, which we want to map out with you, our member states. I would like the EPW2 to be as promising and visionary as the first one, but above all, to be an innovative example of collaboration and exchange between us from the beginning of its design to the end of its implementation. I would like us to be proud together in 5 years to be able to say that we have contributed, even modestly, to improving the health of our fellow citizens, especially the most vulnerable. At the end of this term, I would like to have contributed to strengthening the credibility of our beautiful organization, both in its scientific normative role and operational excellence, particularly in the humanitarian field. And I want to share with my team the honor and trust that you have placed in us by fulfilling my role. The credo of our work will remain truly leaving no one behind. There is a saying, gratitude makes sense of our past, brings peace for today, and creates a vision for tomorrow. So to everyone here today, thank you again.
So back to work now. Thank you. Now I am honored to give the floor to the Director General for his remarks. Dr. Tedros, you have the floor. Thank you.
Thank you very much, Mr. President. Excellencies, honorable ministers, dear colleagues and friends. I offer my warm congratulations to my brother Hans, and whose parents also here in attendance, and also to Belgium on his renomination as Director for Europe. Since member states nominated him 5 years ago, I have seen how Hans has devoted himself to serving you and the people of the European region with incredible energy and passion. And your unanimous support today is testament to just what I said. He hit the ground running, and he had to, because he began his term as regional director just 2 days after I declared COVID-19 a public health emergency of international concern. Imagine starting your day, your job, 2 days after a declaration of emergency. He has led the region through that crisis, as well as the Mpox global health emergency, conflict, and many other challenges. And he has done it with unswerving dedication, drawing on his deep experience. At the global level, Hans has made a very valuable contribution to the global policy group and also many of the global activities that we have. Hans, you have earned the confidence and trust of member states of the region. And we have all witnessed that today. And I was so proud. And I hope your parents will also be proud. By the way, I'm close also to his parents. We have met a number of times. They take care of Hans. They take care of me as well, which I cherish. And they always keep me in their prayers, which is so touchy, actually. And I just met them before this meeting. I can see the support that Hans gets, which is also, from which I'm also sharing. So the Kluge family, thank you so much for giving us Hans and for being an amazing parents. And thank you, Hans, again, for everything you have done so far and for your partnership, friendship, and brotherhood. And I assure you of my ongoing support and that of my colleagues in Geneva. And I look forward to continuing to work closely with you, our regional and country office colleagues, and our member states as we implement the 14th General Program of Work and work to jumpstart progress towards the Sustainable Development Goals. As you know, I'm in my second term, and I have started counting down. I have around 1,000 days. The reason I'm counting down is with counting down comes a sense of urgency. And there are many transformation initiatives that we have started, more than 50. And in the next 1,000 days, with the countdown, we want to really consolidate and institutionalize many of the changes that we have started. Many of the changes we have started, as you know, are game changers. So the reason I'm saying this is, especially in the next 1,000 days, with my brother Hans and our other artists and the whole family of WHO, we will do more and consolidate the changes we have started. And this is a call also to our member states, since without your participation and support and guidance, it wouldn't happen. I'm also using this opportunity to give us your continued support even more to consolidate the changes that we have started. But of course, Hans, in the next 1,000 days, you have even more expectation from me for support, big support from you. Once again, Hans, congratulations and thank you for your commitment to promote, provide, and protect the health of the people of Europe. I thank you, and thank you so much.
Thank you, many thanks, Dr. Tedros. And now I would like to open the floor for any intervention from member states on this sub-item, and colleagues should be reminded that interventions are not anticipated on any other sub-item of this agenda. And I saw Hungary. I will give the floor to Hungary on behalf of the European Union.
Thank you very much. Chair, Director General, dear Regional Director, dear proud parents, distinguished colleagues, I have the honor to speak on behalf of the European Union and its member states. The European Union and its member states would like to extend its heartfelt congratulations to Dr. Hans Kluge on his re-election as the Regional Director for the WHO European region. This achievement is a tribute to his outstanding leadership and unwavering commitment to public health and the well-being of all in our region. Mr. Regional Director, Dr. Kluge, dearest Hans, over the 5 past years, you have been a remarkable leader for guiding our region and supporting member states through unprecedented challenges. Your first term has been marked by dramatic events, still challenging, that profoundly tested public health system, international cooperation, including regional cooperation, demanding extraordinary resilience and decisive action from all. We are deeply grateful for your extraordinary dedication to strengthening the health system, promoting cooperation and advancing global health during these troubled times. In this constant succession of crises, you have demonstrated your vital relevance. You were always there on the ground to support those in need. We are thankful for being able to rely on you and the work of WHO Euro, both at the technical level for the development of public health strategies, high-level analysis and clear evidence-based recommendations, and even more so at the level of collaboration, networking, interpersonal relations, thus building trust among us. And that requires a unique leadership profile, combining a drive towards excellence with remarkable diplomatic skills and fair treatment of all member states on equal basis. In this regard, we want to use this occasion to put the spotlight on the strong relationship you have built with member states, but also with the European Commission on a range of specific topics. The European Programme of Work and its flagship initiatives have been of great relevance to our countries and stakeholders. We also would like to emphasize the cooperation between the WHO headquarters and the WHO Euro and the alignment between the EPW and the GPW. Moreover, you have been a strong advocate for health across sectors, championing the health in all policies and One Health approaches, and for the inclusion of communities and social participation in policy building. In addition, we would like to acknowledge and commend you for your devotion and professionalism throughout the election process that you have demonstrated despite being the sole candidate. Not only are your qualifications and abilities impressive, but such is also your engagement in this process, which we viewed as highly respectful of us, of our institution and its practices. Dr. Kluge, dear Hans, as you embark on your next mandate, the European Union wants to reiterate its strong support and partnership. We are confident that under your leadership, the region is in good hands to continue making significant progress in tackling the health challenges of our time. The EU stands ready to work closely with you, your teams, and the whole WHO family to delivering health for all, leaving no one behind. Once again, we want to congratulate you on your well-deserved re-election and wish you a successful second term. We deeply trust your ability to lead the region towards a healthier future, and allow me to assure you that you can rely on our support in your efforts to meet the very diverse need and high expectation of all member states to stay united in our actions for better health for all. Congratulations again for you and your parents as well.
Thank you, Hungary. Now I invite Sweden to take the floor on behalf of the Nordic and Baltic countries. Thank you.
Thank you. Honorable Chair, distinguished General Director, Excellencies, Dr. Hans Kluge. I'm speaking on behalf of Sweden, Finland, Norway, Iceland, Estonia, Lithuania, Latvia, and Denmark. The Nordic and Baltic countries would like to heartily congratulate you, Dr. Hans Kluge, on your re-election as Regional Director for the WHO European region. And we would like to thank you for your strong commitment and vigorous work for improved global health in our entire region during the last 5 years. There have been, indeed, many challenges where you have proved your leadership and your diplomatic skills, and there will be challenges ahead. We are confident that you will handle these in the same safe and stable manner as before. We consider WHO Euro's continued support to Ukraine as the highest priority, also for the coming years. We commend you for the governance reforms already undertaken and would like to emphasize the importance of continued efforts to further strengthen governance in the years ahead. We assure you that you have our full support and commitment. We are confident in your ability to lead the region for the next mandate. Thank you and good luck.
Thank you very much, Sweden. I will now. I would like, if you allow me, to say my personal congratulations to Dr. Kluge, also Romania congratulations, and I should say that our friend, our colleague, our regional director is not only a regional director; is the coordinator of a very strong technical team, which gives support to the member states and gave support in a very difficult period. And I am sure that our partnership as member countries with the regional office will be strengthened in the next 5 years. And if there will be other health crisis in the future, I am sure that we all together will succeed to solve it in a best manner for our people. Thank you and congratulations very much. Now I want to give the floor to Germany, followed by Slovenia.
Thank you very much, Mr. Chairman. Let me first fully align with the statement just delivered by the Hungarian presidency of the European Union. Let me also align with what we just heard from the Nordic countries. And second, Honorable Regional Director, this is what my speaking note says, but to simplify that, dear Hans, it's both a great honor and a distinct pleasure to express Germany's congratulations on your well-deserved re-election as Regional Director of the WHO European region. In my view, this really reflects that not only your remarkable leadership, but also the trust and the confidence placed in you by our region. Under your leadership, the European region has made important strides in addressing public health challenges. Our partnership, I'm very convinced about that, is a role model of cooperation. Our mutual goals, strengthening health systems, improving access to healthcare, and responding to urgent health threats are as relevant today as ever. We look forward to continuing this partnership in the years to come. For the next 5 years, we all know that European Programme of Work will be an important foundation. And we appreciate in that respect the approach of tailoring the collaboration with the member states, since the needs of the member states are different. It is crucial to show WHO's added value for each and every member state, especially, I may add that, for those member states in crisis situations. And in that respect, I can only echo what we just heard from the Nordic countries, that we appreciate altogether that you announced yesterday to take special care of the health system in Ukraine. I extend my sincere congratulations once again. We look forward to working with you to make Europe a healthier, a safer, and a more equitable region for all. Thank you.
Thank you, Germany, Slovenia, followed by Spain.
Of course. Thank you. Sorry. Madam Chair, Director General, Regional Director, distinguished colleagues, Slovenia aligns itself with the statement made on behalf of the EU. We extend warm congratulations to you, Dr. Kluge, on re-election. Over the past 5 years, your leadership has been essential in navigating our region through major public health crises. Your commitment to strengthening health system and building bridges of trust for their successful transformation has been inspiring. Your ability to turn good advice into successful action has made our collaboration truly meaningful. Your dedication to implement adopted decisions by strengthening country work and participatory governance has been of great significance. Slovenia is privileged to have a country office, and we have used it with a great benefit when developing and implementing our health policies. We would like to further explore how to use it in good practice development and exchange with other member states from the region. We would also appreciate if we could strengthen our collaboration through better use of collaborating centers and through the regional network, such as South European Health Network and Small Country Initiative. We are already looking forward to the next meeting of Small Countries Initiative that we will host in Slovenia in May next year. We would also like to commend you for giving opportunity to organize youth to work with you. We believe that youth participation and social participation in general could be one of the solutions in better addressing the numerous challenges we are confronted with. We can't on your support when implementing the resolution. Dr. Kluge, Slovenia reaffirms its commitment to collaborating with WHO Euro in pursuit of better health for all. We have great confidence in our ability to steer the region toward a healthier future and wish you a successful second term. Let me also take this opportunity to congratulate other members who have been elected in various bodies. Thank you.
Thank you. Thank you, Slovenia. I invite to take the floor to Spain, followed by United Kingdom.
Thank you very much, Madam Chair, President, Director General. They are Regional Director, they are Dr. Klug, they are Hans. It's an honor to address you, to congratulate you on your re-election, which is the result of your exceptional leadership and commitment at the helm of the WHO Region Office for Europe. I would like to highlight your vision and inclusive approach, which have been essential in addressing the health challenges facing the region. In particular, your unwavering commitment to equity and international collaboration, as well as your vital optimism, maintained despite the enormous challenges you have faced during your mandate. Spain, as a country committed to improving global health, has found in Dr. Klug a key ally in advancing its international cooperation priorities. Through your leadership, we have seen the strengthening of ties between WHO, Europe, and our country, developing impactful joint initiatives such as support for universal health coverage and the resilience of our health system. We have also concluded the first country cooperation strategy, which we will sign today. Dear Director, over these years, your ability to strengthen regional collaboration and your determination to ensure that health is always at the center of the political agenda have been crucial aspects in achieving significant progress. In particular, we highlight your promotion of programs such as the Solidarity for Health initiative, in which Spain has played an active role, facilitating the deployment of vaccines and strengthening immunization system in Europe and beyond. The deep connection that Dr. Klug has established with health professionals and communities, his defense of human rights in conflict situations, and his humanitarian approach conform a legacy that has been fundamental to his re-election, which we celebrate today. This has left the indelible mark of the region. Spain will continue to support this vision of united action for better health and celebrates his dedication to achieving a more inclusive, resilient, and united health system. We sincerely thank you for your hard work and tireless energy in the service of health in Europe and wish you success in the coming years, as your success will be the success of the region. Dear Hans, count on Spain, count on me as a Minister of Health, which is we are all ready to continue working hand in hand. Before finishing, Mark, as an anesthetist, you have to sleep. Sleeping is an ancient and healthy habit. And finally, congratulations, dear Hans, for you, for your family, and for your team. Thank you very much.
Thank you, Spain. I give the floor now to United Kingdom, followed by Ukraine.
Thank you. Madam Chair, President, Director General, esteemed colleagues, and most of all, Regional Director Hans. The UK would like to align with the preceding reflections and congratulate you on your re-election to the position of Regional Director, and to reinforce the strong basis of trust on which that re-election is based. We'd like to thank you for your work and leadership as the Euro Regional Director. The UK greatly values our relationship with WHO Euro at both senior and technical levels, and we're grateful that Dr. Kluge and his team have worked tirelessly to promote the health of our region. I have personally experienced your passion and committed support to always seek novel mechanisms and systems to improve health across the region, through the ongoing development of the Pan-European Network for Disease Control, you are always thinking how never to leave any nation or individual behind. We're committed to continuing our close engagement to improve the health of those in the region and beyond, and in particular, the UK looks forward to sharing lessons learnt and best practices with you and your team on the prevention of non-communicable disease, collaborating on innovation strategies, and amplifying the work on healthy ageing. Thank you for all your work and congratulations on your reappointment.
Thank you, UK. Ukraine, you have the floor, followed by Belgium.
Thank you for the floor, Mr. Chairman. It's my great pleasure to congratulate you, dear Dr. Kluge, on your role as Regional Director of the European Bureau of WHO. Your leadership has strengthened health system, improved emergency response, and fostered collaboration across Europe and behind. We highly appreciate your continuous assistance on vital areas such as health financing, health system transformation, primary health care, mental health and rehabilitation, and addressing chronic diseases. Your commitment to health security and other critical areas has significantly contributed to improving the health and well-being of people. We are especially grateful for your recent visit to Ukraine, where you traveled in some regions not far from battlefield, such as Dnipro, Kharkiv, and Poltava, engaging with our medical staff and patients firsthand. Your presence offered invaluable support, reinforcing the efforts of WHO and its emergency medical teams, which continue to bring essential care to those most affected. Thank you again, dear brother Dr. Kluge, for your dedication to Ukraine and for the vital work you lead across the European region. Congratulations once again, and thank you for your hard work. Thank you.
Thank you. Thank you very much. Belgium, followed by Ireland. Thank you.
Mr. Chair, dear colleagues, Belgium fully aligns itself with the statement delivered by Hungary on behalf of the European Union and its member states. Dear Regional Director, dear Hans, I also want to personally congratulate you and your rightly proud parents on this re-election. Given your impressive work during your first term as Regional Director, the re-election is much deserved. It reflects your tireless dedication to upholding the highest standards in the fulfillment of your demanding office. And I should add that also on behalf of Belgium, I wish to thank you for your hard work and your many constructive interventions during your first term of office, first of all starting with the COVID-19 crisis. That meant a lot to us and our population. And I can also say, obviously, that it's an honor for us as Belgium to see your unwavering commitment and your sound leadership. Belgium commends the development and the implementation of the European Programme of Work and its 4 critical flagship initiatives, as well as your persistent efforts to achieve health for all, to leave no one behind in our region, while at the same time you have continuously provided vital support to countries in need, responding to numerous, often very complex crises. Thanks to your outstanding communication and diplomatic skills, the regional office has developed fruitful relationships and partnered with many stakeholders, both within but also beyond the region. Your first term has seen the region navigate an incredible series of challenges, from pandemics to natural and man-made disasters. On behalf of Belgium, I reiterate our steadfast support for your leadership during your second term, whatever unexpected crisis may arise. Belgium is eager to engage in the development of the next European Programme of Work, which we expect to align with the 14th General Programme of Work, while at the same time maintaining a bold impetus for the work at country level. So once again, congratulations, Proficiat Hans en heel veel succes. I think I can say on behalf of all colleagues here that we have full trust in your capacity to lead our region together towards a healthier and a resilient future where nobody is left behind. Thank you.
Thank you. And the last statement, Ireland, please.
Honourable Chair, Director General, Regional Director, distinguished colleagues, Ireland aligns with the statement delivered by Hungary on behalf of the European Union and Member States. On behalf of Ireland, I would like to extend our congratulations to Dr. Hans Kluge on his re-election as Regional Director for WHO European Region. We thank you, Dr. Kluge, for your leadership through the major global and regional challenges that have arisen over the past 5 years while you've been in office. Ireland looks forward to working with you and your continued leadership and support over the next 5 years. We welcome the publication of Dr. Kluge's manifesto for your upcoming term. We note your progress towards the development of a new European programme of work, which will facilitate the continuation of key initiatives while bringing about vital innovations to meet the challenges outlined in the 14th General Programme of Work and the Sustainable Development Goals. We would also like to thank our fellow Member States for their support for Ireland becoming a member of the Standing Committee, which will be the first time that Ireland has taken up a seat on the Standing Committee since 2001. Our membership will enable us to foster even more collaborative relationships with WHO Euro and its Member States, and to further contribute to a healthier WHO European region. Thank you.
Thank you. Thank you very much. So to conclude, let me inform you that in addition to the nomination of the regional director, the regional committee in its private meeting also nominated 2 candidates for membership for the executive board, 4 members for the SCRC, and 1 member in category 2 of the Policy and Coordination Committee of the Special Programme of Research, Development and Research Training in Human Reproduction as follows. The regional committee decided that Spain and Serbia would put forward their candidature to the World Health Assembly in May 2025. The regional committee selected Croatia, Ireland, Portugal and Turkey for membership on the SCRC for a 3-year term of office from October 2024 to October 2027. The regional committee selected Romania for membership of category 2 of the Policy and Coordination Committee of the Special Programme of Research, Development and Research Training in Human Reproduction from 1st January 2025 to 31st of December 2027. Thank you. And now I would like to invite you to a break for lunch. After the lunch break, we shall proceed with agenda item 6, governance and leadership of the WHO European region. For that, I will give the floor to our Executive President, Dr. Adriana Pistol, who will chair our deliberation. But before closing this session, let me pass the floor to Gabriel Jacob for some short messages. Thank you.
Thank you, Mr. President. And yes, indeed, we will pick up our programme in the afternoon. Before moving to the governance and leadership agenda item, as you will have seen from the updated programme, we will take the short items on the report of the Standing Committee, followed by matters arising, and then resume our full afternoon agenda. So please do be here promptly for the start of the afternoon session. From 12:30 in the Atlantic Lounge, there is the high-level technical briefing on One Health, to which heads of delegation are invited. All other colleagues are invited to lunch in the other 2 lounges. And as I say, please do return promptly at 2 p.m, please, so that we can start our afternoon programme. Thank you very much and have a good lunch break. Thank you.